business association in the country, including ASSOCHAM, PhD Chamber of Commerce and Industry, CII, AHPI, and FOCIA. Can we have the moderator for the session, Mr. Arvind Kumar from USAID India, and Mr. Shashank Malviya from NTSU to please join us. Over to you, sir.
Good evening all, and sorry that we don't have a tea break at this point. So, to begin with, multi-sectoral engagement is very important for convergence and action on awareness generation, vulnerability reduction, integration of TB-related services, reduction of stigma, and social protection for TB-infected and affected people. The role of industry association is extremely critical in reaching out to our stakeholders. With their reach amongst corporates and industries, business associations today play a critical role of facilitating collective actions towards common goal. Our eminent speakers today are leaders from prominent business associations in the country. All of them have been instrumental in galvanizing support from their members towards the program. With this background, I'll request my colleague to invite our panelists to the stage. Thank you.
Thanks a lot, Shashank. The last panel of the day is always a challenge, correct? It is also an advantage for us because we will not allow you so easily because we are not in any stress that there's no more speakers. So we'll hold it as long as we want to. Anyway, that's the fun part of it. Let me quickly introduce the eminent panel. We have Dr. Upasana, co-chairperson ASSOCHAM, Dr. Giridhar Gyani, Director General AHPI, Dr. Jatinder Singh, Assistant General, PhD Chamber of Commerce, Dr. Shabnam Singh, Principal Advisor, Health Confederation of Indian Industries, and Mr. Pradeep Ghoshal, Representative FOCIA, who will be joining us virtually. Thank you all. Please take your seats. And while it's a challenge for the last panel speakers, we also need, as participants, we also need to show how energetic we are, correct? So can I request all of you to just stand up, at least say hi to the panelist members. Please stand up, please stand up. I want some energy. Hello. Yeah, you can also clap, that's good. That's some energy for them. Good, please, thanks, take care. Please seated. Please be seated. We have slightly structured this panel in a slightly different way because we know that it is the last session and it could be very tiring on participants who have been sitting for 6-7 hours. So we have tried to slightly modify the panel structure. So first thing, we want to have something, you heard about their names and their designations. We are going to start with one fun fact of each of the panelists. Anything interesting, one fun fact about them. So can I request from my left, Dr. Shabnam, if you can start with one fun fact about you.
One fact about me. Okay, the fact is that I think to the point of being, bullish is the wrong word. It's totally obsessive about how do you take care of the statement universal healthcare with trust between public and the private sector. That's, I mean, I really take it beyond the limit sometimes, but that's a fact about me.
Fantastic. Dr. Jatinder, one fun fact about you.
Yeah, one fact is I'm a firm believer in diversity, and since this is the multi-stakeholder consultation meet for elimination of TB in India, I'm a firm believer that diversity breeds innovation. And innovation is the key element, it's one of the key pillars that is actually required to turn around any strategy, any plan. Thank you.
Perfect. Dr. Gyani?
Now, having worked 35 years in government and now representing private sector, my single goal is how do we, bring them together. My whole worry is that if we bring them together, I think India can be on the top of the...
Good one. Dr. Sharma. Dr. Upasna?
Yeah, if you are asking me, I should talk about me. So I'm a multitasking female who is working in healthcare from 22 years and trying to change, image of healthcare and trying to do it with the government. So I am working for PPP model so that, everybody has to get healthcare.
Perfect. I was looking for some more fun facts, like I swam the Suez Canal, I walked some Rajasthan Thar Desert, but good, great, thanks. Dr. Pradeep, if you're there, any one fun fact about you? Okay.
You're getting me?
Yes, yes. One fun fact about you.
Yeah. Yeah, please excuse me. Actually, everybody is sitting there as a health experts, but yes, you know that I love the traditional foods. I jump toward the pani puri. I don't know whether it is there today in the dinner or not.
Perfect, perfect. Thanks. So how we are structuring this session is that this session is all about business associations and medical associations and their role in multisectoral as well as corporate engagement. So we'll certainly be hearing their experiences. We are also going to, after each speaker, we are also putting a rapid fire question. And that rapid fire question is not only for the 5 people, they will obviously respond to that rapid fire question, but we'll also ask the participants here if they have any response to the questions. Okay, with that, may I now request Dr. Upasna Arora to briefly let us know about ASSOCHAM's work in corporate mobilization. We have also known that you have been very extensively, as an association, you have been very extensively involved in engaging the media for elevating the TB programs amongst the masses as well as with the corporates. We'd like to hear more from you.
So ASSOCHAM is actually working from many years for this program, TB Mukt Bharat. And for that, they have, have done 3 lakhs people for screening for the TB. As well as they have organized a meeting with our health minister and all the corporate sector. So when everybody was there with the health minister, so 10,000 TB patients has been taken care by our corporates. Not only this, media is playing a major role. So ASSOCHAM is, working with like this, that our media, ASSOCHAM's media is making different kind of videos regarding awareness program for TB, as well as we are distributing different kind of information, education, communication, material through our partners. Partners, our members who are ASSOCHAM members. So we are trying to create awareness, as well as we are working with the, different areas, slum areas, or with the help of our members, we are trying to create a change in the society. So everybody who is having TB, they should not leave their treatment in between. Because TB is 100% curable if you are taking your medication on time and you are taking your whole treatment. So we are trying to teach this thing through different medias, as well as, I really wish that if we can hire some very influential personality like Amitabh Bachchan, who was doing an ad like 5 दिन से ज़्यादा खांसी TB की निशानी हो सकती है. So nowadays we are thinking about this so that we can, TB Mukt Bharat Abhiyan, so we can do something more value-added thing for this. And ASSOCHAM is actually, after this 10,000 patients, we are still approaching to other different industries, not only healthcare. We are trying to, everybody has to go for TB patients adoption. As a CSR or sometime as a just as a social responsibility, not only under CSR. So that is how ASSOCHAM is working. Thank you.
Thank you, ma'am. So my question to Dr. Girdhar Gyani is to please elaborate on the role of medical association in TB elimination, sir. Sir, role of medical association in TB elimination.
4 slides I'll show. Okay. Yeah, good afternoon. Very quickly, I will. You see, AHPI, you see, we have got quite a few associations in our country, and AHPI is one of them, starting from 2012. Basically, as you know, association, what is the role of association? Any association, basically to do advocacy on behalf of the members with the government and with the other stakeholders, including the consumer organization, so that they are able to do the job what is supposed to be doing that. Now, our association has taken up the objective for working for the well-being of the common man. And that is where we have, we are working with the government on achieving the universal health coverage. Now, we have 20 chapters in the country, and this is the way each country has got its own executive body. And today we have 21,000 hospitals as our members. Now, HPI obviously recognizes tuberculosis as a threat to the humankind. And recently, when Honorable President launched this program, we have taken up this issue with all our chapters, that is 20 chapters. And I will show you quickly, these are some of the major hospitals which are our members, which actually have launched the program in the very right earnest, starting from Medanta, Yashoda, Esther, DM, Ujala, Cygnus, Fortis, and of course the Meenakshi Medical Mission Hospital in Madurai. Now, you see, the question here is that so far, tuberculosis program was considered as a public health issue. To be very frank, I don't think we ever thought that private sector will be involved, because government, in fact, were doing the program of their own. Now that the gravity has gone to the extent that we need the support of the private sector, let me mention here one thing here, that government has limited resources. They may have resources in the rural area, but overall, if you see, they have limited resources, going by the fact that they invest 1.3% of GDP, while private sector invests 3.7% of its GDP into the health sector. And the tertiary care segment, we have private sector has got 85% beds overall in the country. So I think that is the strength of the private sector. And now that government has decided to engage with the private sector, I, on behalf of our members, can assure that we will take this program forward with all our might. And I am sure, with all this, we will be able to eradicate the tuberculosis by year 2025. So this is, I think, in short, I wanted to say from us, So this is, we have already made the roadmap also, that how we are going to do. We have decided to have chapter formation, and through this, which will be launching the tuberculosis program, the corporate hospital will be displaying all our, display units in the hospital on where the reception and wherever OPD consultancy is going on, we will be displaying it on. So this, we have already drawn the roadmap for our members, and I think with the support of union, we will be achieving the goal what has been envisaged for private sector.
Thank you. Thank you very much. I hope I'm audible. So as I was mentioning in the opening, there will be a rapid fire questions. So my first two rapid fire questions is for the panelists. So my first question is, according to you, what would be one critical element for success of multisectoral partnerships? If you have to identify, okay, this is the most critical element for ensuring success of multisectoral partnerships, what would be that critical element? Do you want to start?
Sure. The most important critical element will be forensics on all that is being done as well as being planned. If you do not audit and see what is working and what is not working, the output that you're seeking will not happen. So that, to me, is the most critical, as a nation, as a country, We've moved hugely forward with governance. Monitoring still is work in progress, but forensics are just not in place.
Perfect. Dr. Jatinder?
I think one of the important factors that need to be taken care of is the role of micro, small, and medium enterprises in this entire stakeholder engagement program. Because I have been, like PhD Chamber has been the party to many programs with the union, with USAID on TB elimination program. And all the time, what comes along is basically, we come along, the name of some big corporate entities who through the CSR programs and budgets, they manifest or, do the operations or programs for TB elimination. And if you see these stats, there are close to 7.9 million micro, small, and medium enterprises employing more than 110 million people, contributing to 40% of the exports and 40% of the GDP. And if MSMEs, although they don't come under the CSR ambit, but at the same time, if they are sensitized, if they are evangelized in terms of involving themselves in the elimination of TB program, that will be one of the game changers. Because what has been seen that, entrepreneurs, they are driven by two factors whenever they go for any project or scale of any project. One is the internal factor and one are the external factors. The external factors is more about, the economic return of the business in terms of business performance, how they can get business from the entities, both national as well as global. The internal kick that they get is basically the emotional return, that is through their philanthropy or through their charity. So what it has been observed, if we are able to engage the MSME entrepreneurs, catering to both internal and external factors by, involving them in the supply chain process, involving them with the big OEMs who are, churning their CSR projects for TB elimination, I think that would be one of the game changers.
So you're saying focus on MSMEs is one critical element according to you. Dr. Gyani, what about you?
Yeah. You see, any program will have two major components. One is creating awareness and identifying the patient. So this is the first component. And second component, obviously, is providing treatment. And here, providing treatment is simple, but making continuity of the care is the key issue which sometimes is get misplaced. Now, as far as the private sector is concerned, it will work on the second segment. Because creating awareness and identifying patient is more of a public sector or public health issue, although somewhere private sector also will play a role, but limited role. But in second aspect, providing care and continuity of care, we will be playing the major role. Now here I must mention to you that there are around 40,000 small nursing homes, which we call, next to the, community. These are below 30-bed nursing home, which is numbering 40,000, a huge number. Now, they are our secondary member because they are not directly our member, but we have connectivity with them. So I think to make this program success, we have to reach out to this 40,000 small nursing homes.
Engaging the smaller, medium, private sector hospitals in care is one critical element for this multisectoral success, according to you. Dr. Upasana, what is the one critical element for success of multisectoral partnerships?
According to me, it's a mindset of, different sectors people. If everybody will think on a same pace, then there will be no problem. But, when we talk about government sector, so, and if right now we are talking about TB, so, everybody is thinking it is a responsibility of government. Or sometimes they feel it's a responsibility of big hospitals. Unless everybody will not realize it's a Jan Bhagidari. Everybody has to play their role. So according to me, it's a mindset of everyone. Unless everybody will reach to a same thinking, it is going to be really critical.
So bringing all of them in one page, making sure that they're all together is the most critical element according to you. Okay, I'll start with you again. Multisectoral partnerships, forging as well as managing multisectoral partnerships has its own challenges. If you have to identify one challenge, according to you, that is affecting the multisectoral partnerships, what would it be from you?
From me?
Yeah.
So one challenge, most important challenge in healthcare, and I think in every sector, is human resource. That is a big challenge for every sector and for everyone. So according to me, it's a human resource. You are supposed to, create a skilled manpower as well as right mindset. Only then you are going to face any challenge.
See, I will, extend what Upasana mentioned. Today the awareness and consciousness among the community about the healthcare has increased manifold. More so with the government launching schemes after scheme. When we are saying that 40% of the population now is going to get benefit of 5 lakhs rupees. Now all these people now are coming up. So now our hospitals, which are already, let me say here, that we have only 1.3 beds per 1,000 population, while you need 3.5. So that means we are very short of the resources in terms of infrastructure, number of beds, doctors. Now that means when the hospitals are already engaged so much in the day-to-day provision of the healthcare, any additional program, we will have to really design a vertical for it, generate, that enthusiasm and, mechanism or framework within the hospital to run the tuberculosis program. So I think this will be a challenge.
I think one of the challenges is the social stigma and the taboo which is associated with this disease. Because it has been felt like we work with a lot of corporate entities, and our HR leaders sometimes say that even people who are infected with tuberculosis, they don't disclose that they are having tuberculosis, because that will actually result in some discrimination or de-alienation from the mainstream. So I think if we are able to make this disease as it's a public disease, it's a disease of me and you. It's not about that I am only the carrier, I am wholly responsible, because since it is nothing, basically it's a public disease. For example, each and everybody like who is sitting in the hall is an equal contributor to this. Probably one of the persons can infect the entire, people who are sitting here, because the infection may take around maybe like 6 months, even to some few years altogether. So my point is, like, if we're able to glorify some of the cases that who are already taking, the tuberculosis, treatment, they're taking this ATT regimen without any, obstruction or without any some sort of, disruption. I'm sure that they will be the role models for others to emulate. The only thing is that we need to come out with some of the good IC material that can actually lift the veil of the stigmata and social taboo that TB is basically, it's a communicable disease and may result in, death, or it may result in, multiple infections to others. So I think we need to work upon this.
So, number one, I totally endorse what my colleague here has said. That is the most important. The other one is to find a common language for this multi-stakeholder. There is no commonality in the language because everybody is silo-driven. And when you speak, don't speak in a common language to that one person, and that's the ASHA worker. Everything you will see in the presentation always comes down to that ASHA worker. You're speaking in different languages. She's so confused that we are jogging at the same point like Brownian movement.
I think that's a very important point of maintaining or bringing a common language, particularly when we speak to the field workers. Dr. Pradeep, I missed out on your critical element and one challenge. Could you please highlight what do you see as one critical element for success of multisectoral partnerships and one challenge, according to you?
Yeah, actually I was listening everything, and I'm very sorry that I'm not coming up as the video is concerned. But very clearly, until unless there is not a constant interaction and communication and engagement for trust building, it's very, very a field task. As because in the platform, different stakeholders are there, and the different mindsets of stakeholders are there. Their strategic intents are something different. And I was also thinking, as far the corporate is concerned, when you are saying about the corporate, then again you have to think about the NGO aspect also. You know that in most of the corporates, either they are directly doing the work or they are doing that particular any of the project through the NGO partner. Whereas that is a missing link that is there. When you are giving that particular the responsibility to the corporate, where the corporates are ultimately going? They are going straight to their mother NGO. And there, in fact, that particular chunk of the social capital, they are in fact doing all sort of activities in the field. So we have to see that particular bonding is very much needed. And second thing is very, very important what our other panelist has also said. You know that suppose I am one of the corporate person and you know that mine governance system is something different. Okay. And suppose I am here to play something regarding that particular issue, then where there is a lacking of commonality, we need to meet some sort of protocol. We need to formulate some sort of protocol which will be applicable to all the members all across. Until unless you're not making the protocol, only being a member in the platform will not work at all. That is very, very important. As because what I was also thinking to put before all of you, as per the FOCIA is concerned, FOCIA is a big platform that is based in Kutch, where around 150 big industries are there and around 3,000 MSME are there. So you can see what is the whole, the number of industries are very, very high. And when there is an interaction with the corporate, as because that is also very important. When you are going to discuss with the corporate, they are going to give you some sort of good element inside. What is the thing? Suppose they are making one sort of budget for the entire year, then it is very important they have to put something on the health part also. That is called the basic need. And we are, from our focus side, we are saying to the each and every corporate members, please put some sort of funding over there. Any sort of awareness is required. We'll be there to give that particular awareness so that you can also convince to your top of management.
Perfect. So
until unless there is a, yeah.
So perfect. So you're saying that one critical element is that the partners should also put in funding. So our next speaker, Dr. Jatinder Singh, I would like you to briefly highlight about PhD Chambers of Commerce. But more importantly, since morning we have been hearing individual companies present their work and some achievements of theirs. As a business association, how do you sort of bring all this together, expand these experiences, best practices to other companies? Over to you, Dr. Jatinder.
Thank you, Mr. Arvind. In fact, it's a very important question, as rightly said by Ms. Shabnam Singh, that we need to do silo busting and everybody has to, speak a common language. In terms of going beyond this thing through our social arms, PhD Rural Development Foundation and our Family Welfare Foundation, which is the foundation part of PhD Chamber, we are doing many healthcare related activities and TB is one of the important mainstays in that. What it has been seen that, as you know, in the earlier session, there was a presentation on these PRIs done by Karnataka State. I think that is definitely an eye-opener until unless we involve the development sector, the NGOs, as well as the PRI in a major way. I don't think we are actually able to, turn this around. Now, the point is again, the question comes, since we have some of the success stories, why not those success stories can be replicated by other states also? Why don't we share our, some of the best, case studies so that everybody is on the common ground? And it has been felt also that now we have started working with many cooperatives also. And as we know that since last year, we have a different Ministry of Cooperation, when everybody is aware there are around close to 9 lakh cooperatives across our country, and these cooperatives are, one-to-one with many of the, rural population, because they are the first hand, you can say, the soldiers, the foot soldiers for all the people whenever they are in distress. And these are the, cooperatives or the officials of the cooperatives who are actually the role models for many of the, rural population. So my point is that as the corporate entity, the extension has to be beyond the mindset of the CSR only. We have to actually, embrace NGOs, we have to embrace development sectors, we have to embrace the Panchayati Raj institutions, we have to embrace cooperatives so that we are actually able to improvise them, we are able to enrich their sort of models, some of their policies and programs, so that we can have the footprints of TB elimination programs along with whenever they are making new plans and policies.
Thank you, sir. Moving towards our next panelist, Dr. Shabnam. Ma'am, as CI has been working closely with Central Division, I'd like to hear is how partnership model with corporates will lead to the elimination of TB.
Somebody can just put the presentation now.
right?
So our model is focused on a very simple thing. हर घर में जो पैसा देता है लोग उसकी बात सुनते हैं, right? So we came from the perspective of every employer is responsible to ensure that he has a TB free workplace. And with that, we started working with this workplace campaign in August 2020. And then we expanded it and told them that it's their responsibility to ensure that any and everybody who is associated with them, which is a multitude of small and medium enterprises, who do not have the ability to be able to work the same way as the large corporate. So there are about 10,000 large companies with CII and about 3 lakh small ones. So this, for us, was our calling card. You are paying them the money. You will ensure that every month you will reiterate this. नहीं तो क्या होता है? People come, they will tell you, they may not come back for the next 6 months. As we all know, you see it every day in your lives when you watch television with advertisements. They keep coming back, keep coming back, keep coming back till you sing their song. So that is what we have tried to do. We've made a teaching app. We have made sure that they sign a pledge and have a document with exactly like what was said earlier, a best practices compendium. We have, along with the ministry, worked, to your point, to ensure that every state, so we go back to the state, have round tables with the health ministers downwards to ensure that the work, whatever work that they are doing, it gets reiterated, and corporate India listens into this. So the local CII officers are also there, as well as the government, so that the coordination for them works well. Very recently was when we were supposed to provide nutrition. Upasana was also there immediately for TB patients. So because of this constant interaction, you suddenly realize the strength of your multiple stakeholders of what they can do. So exactly on this, on the adoption, we already within 24 hours, we identified 35,000 patients, put the logistics into place. The most important was, and Dr. Gyani also said this, that the most important thing is how do you get your stakeholders to actually deliver? One thing is the money, right? The second is how do you put the logistical chain in, and that is where I think CII has tremendous strength in making it happen. They did it in oxygen, we are doing it in TB. Thank you.
Time for our next round of rapid-fire questions. This is a little bit action-oriented. So you all have tremendous experience in working with corporates, medical health facilities, and you all know how the Government of India, particularly the Central TB Division, is very much interested in promoting multisectoral partnerships. If you have to tell one action or one suggestion for NTEP for improving multisectoral partnerships, or more importantly, one action that you expect from NTEP for promoting multisectoral partnerships, what would be that one action you will ask from NTEP? Anyone?
You want to say that one action on the behalf of?
If you have to ask one action NTEP
Right.
that they have to do to improve multisectoral
Who has to do? Who?
One action you are asking. One action to NTEP, National TB Elimination Program.
Okay.
To improve multisectoral collaboration.
Okay, multisectoral. So I think let me be very frank here today, because I want to tell you one thing here, that unfortunately there is a big trust deficit today between the government and the private sector on the health front. Because I want to be very categorically on this statement. You see, we have, we sometimes play to the gallery we do sensationalization through media and through some of the statements from the leaders that the private sector is profiteering, private sector is doing this, that. Now, without knowing, nobody, by the way, knows in this country what is the cost of delivery of healthcare. Now, without knowing that, we try to put down the private sector. I'll give you one simple example. There is a central government health scheme whereby the government ensures providing healthcare to the pensioners, large number of pensioners, MLAs, MPs, judges, and all that, Now, this is supposed to be provided by the government of India, or the government, let us say. Now, government doesn't have the resources in terms of infrastructure, so they talk to the private sector. They engage private sector. They impanel the hospital. Okay, please come and provide the healthcare. Having impanel, later on, the government acts as a regulator. Now, you see, this should be obligatory that, okay, you are doing good job for us. Okay, at least that kind of approach should be there. No, but I think then they start, controlling and, not paying them the dues, what they deserve, delaying that. This has created a huge, unfortunately, I am very pained to say that, that the private sector, which is available to you, you can exploit the private sector. But now, because of the trust deficit, that is one of the challenge I want to say, because I am very concerned that tuberculosis should be our priority and would be priority of HPI, like CII, and all of us. We are together on this one. But government has to realize that this trust deficit has to go.
Perfect.
And I think unless that is done, there will be little problem. But I'm not saying that because of the trust deficit, we will not do. No, job will be done, I can assure you.
So got it. So you are speaking about need for greater trust, need for greater appreciation, need for timely response from the government, whether it's payment or whatever is that.
Yeah, Mr. Arvind, you told about one recommendation that we can give to CTP. So I think like already many things have been discussed. What I feel that we are in new era of total digital transformation. Although we have many, you can say, technology elements in all our IC materials, in all our interactions at, different touch points. But what I've seen of late, we have like Metaverse and Web 3.0. And these are going to be total game changers. And as we are also having now 5G, maybe in another, 1 or 2 months' time, and maybe followed by 6G, another, year or so, this will be a game changer. Because what happens, the Web 3.0 technologies like blockchain, they are basically the decentralized ledger points wherein we can actually track and trace as well as we can see like where we are heading for. And right now, as we have more than 75,000 startups in India, and if some of these startups are given some of the problem statements by CTEP, that, particularly as a blockchain, model, as a platform, how you can actually connect all the dots wherever there are the lacuna, where there are gap. I think that will be one of the great services CTP can do for, the government, for all the citizens to eliminate tuberculosis. And one of the important things, another thing like CTP can do is like, for example, every ministry is going for, the startup challenges. So on the same lines, if CTP along with USAID and Union can come out with some of those problem statements, their own problem statements, and which can actually, they can also woo some of the big corporate CSR entities also to part of the CSR activity can also go in such, those activities. For example, coming out with some of the innovative challenges. I think that will be one of the biggest services for elimination of tuberculosis.
I think those are very interesting suggestions that you have proposed. Emerging technologies and how do we leverage the startups, probably the grand challenges on any specific area. What about you,
So I'd like to give two suggestions. Number one is that they have opened government, growing on what Dr. Gyani has said. They've started opening the doors of connecting, thanks to COVID, to the private sector and acknowledging that the private sector is extremely critical for their success. However, that door it's just a chink which has opened. And if you don't open it fully and recognize it, that it is just not the planning which is done by the government or the whichever arm, and then they bring in the private sector and say, okay, this is the plan, pick what you can do. No. If you want me to be able to perform on the ground, I have to be there while you strategize. And I can tell you I can do this, I cannot do this, right? And that feeds into the trust deficit other than the finances. And the second very, very important point in this is you must, and I would like to underline it 100 times, that unless you have a cheerleader who is accepted by the masses, like you have Deepika Padukone who's speaking for mental health, if you don't have that, I don't have a recall when you come and talk to me. I cannot relate as a common person to this particular piece. Thereby, if I cannot relate, you've lost me within 5 seconds of opening remarks.
Yeah, and from my side, I really want that I would like to suggest them that they should reward somebody who is actually working for them. If they will just reward that corporate or that person with a certificate or something like that, any kind of award always gives you encouragement to do better. And you become a role model for others. Everybody wants to get some appreciation. So if they will get this thing from the government, then it is going to be easier for them.
So recognition, appreciation, even if it's a small win, appreciate it. That's what you're trying to say. Mr. Ghoshal, Pradeep Ghoshal, any suggestions from your side for NTEP?
Yeah, it is very clear. No overlapping salary, please. And there is a need for integration. Suppose in the case of the any district, and we are finding if there is a lack of integration, then it is a big issue, in fact. So what I can propose over here is, suppose we can create one sort of platform where we can ensure the equity from the government also, and as per the corporate members are there in a respective district, they can also put some sort of equity there, and we can plan one sort of district implementation plan for the entire TV mission, where we can also fix the responsibility of each of the members.
Okay. So getting to know in advance the sharing responsibilities, clear equity as to what's the government going to do, what's the private sector going to do is what you're saying. Wonderful.
Exactly, yes.
Wonderful. So we have you, Mr. Pradeep, as the final speaker for us. Could you tell us more about FOKIA? Because you're a regional association, Kutch is the largest district. We have all heard it in the last sessions. And you have a large number of companies. How are you undertaking this multisectoral and corporate TB pledge initiatives? Again, the same question, what I posed to Dr. Jatin, the same question I'm posting. Like, there's so much of good practices coming out from Kutch. 5, 6, 10 companies are doing wonderful work, but you have hundreds of companies. How are you going to make sure, or what should the associations do to sort of scale it up to all the corporates in that area?
Yeah, very nice. As because I have already briefed that FOKIA is a platform where around 150 large units are there and 3,000 MSME. Now it is a big challenge for all of us also how to align all the industries who are the member of FOKIA. Yes, we started with something. Around I think 12 members are there who has already gone for that pledge, and we are also taken a lot of other academic institute also, as because in the academic institute what we are seeing, many students are coming, and in that particular platform we are seeing all about our TB mission and what sort of actions needs to be done. Through that particular action, in fact, we have increased our bandwidth as per the volunteers of TV is concerned. That is one of the bridging between the government scheme and along with the field implementation part. Apart from that one, what we are thinking from the FOKIA platform also, how to tag CSC, the Common Service Center, so that the presence of CSC is very much in the field, and so that the benefit of CSC can be doctored and one sort of convergence can be made, that can also act as one of the bridge between the community and for our mission. As per the FOKIA is concerned, FOKIA is also putting a lot of effort, not only for that along with the corporate, but also putting before the case, before the government, so that the necessary support from the government can also be ensured. Apart from that one, I can also highlight over here, all the time we are putting other innovative activities. Like one example I can put, you know that many of the corporates or the NGOs are doing many of the social development activity as per the livelihood concern. Suppose there's the livelihood, they are also generating some sort of product, and that product is going into the field. In that particular product, we are putting the TV message so that that can also reach to the masses. Apart from all other things, we are also promoting to our industries to please come up with the innovative actions which can also attract all our communities, and they can also be more aware. Apart and also I want to highlight over here that we have attached our activities with the Sarpanch Association in the Kutch, which is one of the big chunk. In fact, suppose you are percolating your message through the Gram Panchayat or the respective Panchayat, so that you can create one sort of bandwidth as per the awareness is concerned. And in fact, you are very correct. As per the Kutch is concerned, you know that there are a lot of industries now upcoming also, and so there is an influx. Management is very, very important, and there is a transportation part also. So we have gone for a TV pledge with the Kutch District Truck Owners Association. And in every forum, suppose Fokia is involved in many of the activities, and in that particular activity also we are putting this pledge before all of them, so that we can create some sort of awareness among everybody. Some of the well-known members who have done very good activities as per the TV is concerned, like Adani, Wellspun, the CGPL Tata Power, and our the Sarpanch Association, the Academic Institute, even the Kutch University, which has a big presence over there. Through that particular institution also we are promoting how can we create one sort of awareness. And moreover, I want to highlight over here, the Kutch district administration support is very, very good. So in very small time, during the COVID time also, we got that particular success. And we have a big plan so that we can take this forward and we can make the saturation effect in the entire district. That is a small, the things for Fokia and what we want to do in future.
This is wonderful. Thank you. I think you highlighted a lot of points in that brief note, from small actions, like even in your messages being put in your supply chains and products. That's one thing which came out. Engaging the Sarpanch associations is again a very interesting part. But the most important point, finally, which you said, is that how Fokia is very closely working with the local government authorities. I think the key for this is just not one party working more sort of actively, but if both the parties, the government, the private sector, as well as the civil society organizations are together, they have a common understanding, then it makes the work much more easier and results-oriented. There's a lot of points that have come out from this panel discussion, from the associations using their own media networks, the need for involving celebrities and their interest to take up celebrities to support causes. Not to just think this is just a corporate responsibility, but as a joint responsibility with clear equity and roles and responsibilities defined. Having some sort of an audit, a monitoring or an audit system, engaging the micro and small medium enterprises, ensuring there's a trust between the government and the private sector, smallest level of appreciation from the government for all the good work that you're doing. Your emerging technologies, leveraging emerging technologies, whether it's AI or blockchains, again, is coming out. That could be an area where the business associations could be actively engaged. Involving the startups. India has got a large number of startups. So there's a lot of points which has come out as the good work of business associations, as well as the opportunities they see in terms of involving corporates for public sector programs. We have a few minutes, so if there are any questions from the panelists, from the participants, we can possibly have 2 or 3 questions. Okay, please. Maybe 2 or 3 questions, if there's any questions from the participants to our eminent panelists. Okay, looks like all of you are tired and need a tea break. So I just wanted to thank all the panelists for their time, very candid response about what they have been doing, what could be done better, and some clear, concrete actions that they have proposed. So thank you once again for all of you for your time, and it has been a really, really pleasure having you as our panel partners. Thanks.
Before we are closing this, I would like to say thanks to you. This was a quite tough session because everybody was out for tea. But you made it so interesting that everyone was coming back with the tea.
And one line I will say about the union, actually the way they have been working with us, in fact, we have taken this as a corporate social responsibility. So I want to appreciate the effort of the union, and I have committed to them that AHPI will work together and make this program success.
Thank you, sir.
And last final point from my side, in fact, as we are all praising Union and USAID, Union has been instrumental and the guiding force for many corporate entities for all these TB elimination programs. And in one of the conferences, we did around 4 projects with the Union. And one of the conferences, there was a lot of discussion on collaborative commons. That because as we have seen, most of the corporate entities, in most of the cases for TB elimination programs, they are reinventing the wheel. So we came with some, idea, some model. For example, if we have Wipros, the likes of Wipros and TCS and, Byju's and Paytms and L&T on a single platform. For example, L&T can come with some of the best project management tools. The TCS can come with some of the best technology like AI. The Hindustan Unilever can come with the best of the supply chain things. Similarly, the Paytm can come with some of the best fintech models. Why not to have collaborative commons? And we actually come out with some of the best, you can say the POC, which can actually, solve a lot of the multiple problems in terms of whatever problems we are facing for eliminating tuberculosis from India. Thanks to Union for this. Thank you.
You can see the passion of our panelists. They don't want to even leave the last minute. So if you all of us, we can take on for half an hour more. Okay, thanks a lot. Thank you.
Thank you. I would request the speakers and the moderators to remain seated. Thank you. It was really a very wonderful session and a very interactive one indeed. And people could actually join us back from having their cup of tea. I would like to request Dr. Vinod Garg, STO Rajasthan, and Dr. Sunil Chetrapal, Director AHPI, to please present the token of appreciation and the certificate to our speakers, please. We'd like to request Dr. Vinod Garg and Dr. Chetrapal to present the memento and the certificate to Dr. Upasana Arora. I would like to request him to present the memento and the certificate to Dr. Girdhar Gyani. I would request them to please hand over the memento and the certificate to Dr. Jatinder Singh. Thank you, sir. I would now like to request you to please hand over the memento and the certificate to Dr. Shubnam Singh. Thank you, Mr. Kaushal, who has joined us virtually from Fokia. I would like to request Sir to please present the plant to our moderator, Mr. Arvind Kumar from USAID India. and also to Mr. Shashank Malviya from IQVI. Request all the speakers and the moderators to join for a group photograph. So thank you all. With this, we come to an end of day one, session one. I would like to request, day one agenda, indeed, sorry, my apologies. I would like to request Dr. Jyoti Jaju. Can we have a round of applause for our speakers and moderator, please? Thank you, everyone. Now, I would like to request